This is Dr. Corey Maas on Looking Your Best. Today we were talking a lot about hair and hair removal, and we also were talking about hair transplantation, an area of particular interest to me. With hair transplantation, we can transplant hair from the head or other areas of the body, frankly, to anywhere on the body that we lose hairs. The eyebrows and eyelashes are good examples of places that people don't often think of. We think of hair transplantation typically with men and balding, but really women lose hair not with the same intensity, but certainly the same frequency of men. It's called female pattern balding, and very commonly medical therapies for hair loss are effective in women because they still have retained hair, just about as effective as they are in men. Once the medical therapies are set aside and one's determined that the best course of action would be hair transplantation or hair restoration through grafting, there are two basic techniques. One is called the FUE technique, and this really has to do more with how the hair is obtained than how the hair is planted. The FUE technique stands for follicular unit extraction. And in FUE, there's a small punch graft that's used that can be mechanical or it can just be handheld. There's a couple of devices, NeoGraft is one of them, and there's a couple, Smart Graft is another, that use a little rotary wheel. But just a punch graft is done. The back of the hair is very closely cropped so we can spread the little graft holes out. They're not closed. And we can borrow the hair in about a 1 millimeter diameter punch. Those are carefully placed in saline for preservation. The slits are made in the areas where we want the hairs, and they're transferred into those recipient sites, whether the brows, the lashes, or the hair on top of the head. The other technique, the FUT technique, is follicular unit transplantation, and really you notice that both of them have the word follicular unit in them. And that's really the key to hair transplants. There is a lot of discussion and controversy, if you will, and it's more from a business standpoint, with the companies now making very expensive devices to help assist with FUE, the follicular unit extraction, whether the FUE technique is better or the FUT technique is better. And with the FUT technique, what's done is a strip of hair that's about 1.5 centimeters in most cases is borrowed from the back of the hair where you'll never lose it, and it's very carefully closed. I've never had to revise one of those scars, and I've seen the pictures in the magazines in the back of the airline, and I can tell you I've never seen another patient, even one that was referred after a previous hair transplant to me, that had a scar like that. Not that those can't happen, of course, but they're quite rare, which to me means that FUT and FUE have comparable and excellent technologies. There are people that I think are good candidates for FUE over FUT, and those are people who don't need that many grafts, certainly less than 1,000. Once you get more than 1,000 holes in the back of the scalp, it's a very large area of hair that you're having to shave, and that really is difficult to disguise. When you're doing FUT or borrowing or the strip technique, as we describe it, we don't really have to shave the hair at all when we're harvesting it, just in the area of the strip we're borrowing, so people are back to normal lives and activities within a day or two. With a hat, certainly anyone could. With the FUE, the other issue with large numbers of graft is, after you have 1,000 1 millimeter holes, well, that's 1,000 square millimeters of secondary intention healing, and that's quite a defect. It can look a little bit mottled or irregular in the back of the head. So there are limits to FUE. I like them. I like NeoGraft. I like Smart Graft as basic units, and I like punch grafting. We frankly can do just as good of a job by the little mechanical punch grafts that I have that I hand hold when we do it. So all of those are good techniques. There's not really one that's better. It comes down to the artistry of the hair surgeon that's being used, and certainly the technician. That the technicians that are assisting the surgeon. That's important in designing the hairline and placing the little slit, which we use tiny little needles now. We don't use the knives anymore for slits. And the follicular unit is exactly how the hair grows on the head. It's in 1, 2, or 3 hair groups, as I've described previously. And if they're transplanted either as an FUE or FUT as a follicular unit, the hair that's placed and growing is really, you can't tell the difference between it and the nascent hair, the hair that was there before. and the hair that's growing around it, which is a great advance in this technology. So my summary on this is which is better, FUE, FUT, there isn't a right answer for that. It really comes down to the surgeon. In general, with larger areas of coverage, certainly more than 1,000, FUT, I believe, is by far the better technique to use, just because we can harvest an unlimited amount of hair and have a small linear scar that's almost invisible and get people immediately back to work. The other question this brings back up is the new robotic hair device, transplant device, which is called the ARTIS. And in that device, your head is set in a very specific cradle that holds it completely immobile, and the cameras on the robot allow for the graft to be harvested by the FUE technique and transferred for transplantation into areas that are predetermined. And this technology is not new, but it's certainly evolving and getting better. And I would anticipate in the next 3 to 5 years, not only will it get better, but it will be more cost efficient, which I think is important. We want cost efficiency as well as efficacy with this. So the FUE, FUT technique, I think, is confusing, and the discussion or debate about it amongst consumers is confusing. I will say that really both techniques work. FUE is better for smaller numbers of grafts than it is large sessions of hair transplantation. They both are very effective and efficient in the hands of an experienced and talented hair surgeon. As much as they've tried to commoditize the hair graft world with different clubs and organizations, really the idea is to have the artistry, the ability to design an appropriate hairline for a man that wants hair, or woman that wants hair restoration, or to properly place and get maximum results with eyebrow or eyelash transplantation, is really down to the surgeon and their technique. Critically important that we have that. Very rewarding procedure, very high satisfaction rates, as you'll see looking online, and people really get long-term growth, especially with the use of concurrent medical therapy to prevent further hair loss. If you have any other questions about hair regrowth, hair transplantation, or hair in general, please don't hesitate to write me. drmaas.com is my video blog. You can write us at maasclinic.com. That's with 2 A's. And I'm happy to answer those questions, and as always, keep your looking your best. This is Dr. Corey Maas.